Brazil a case study. A special case study of Brazil is needed because just a few months before the start of second wave of corona in India, Brazil also faced a similar wave, and thus we could have learned a lot from them. So we will start from the second wave of coronavirus in Brazil. Hello guys, I am Mansi and you are watching Coronavirus Nightmares when comes into reality. Stay safe at home and be secure. In our last video, we talked about China and how they overcome. And if you haven't watched that, go and watch now. So, starting the case study of Brazil. Start of the second wave. The second wave of COVID-19 is ripping through Brazil, pushing hospitals and ICU towards collapse and claiming record number of daily deaths. Brazil has broken its record 3 times this month for the several deaths in 24 hours. On that Wednesday, Brazil's health ministry registered a devastating new high 2,286 lives lost to the virus. In India, we have approx double this number. So please be at your home unless it is very urgent. So coming to Brazil. In total, more than 270,000 people are known to have died due to COVID 19, making Brazil the second highest nation death toll after United States. In 22 of Brazil's 26, ICU occupancy has surpassed 80%. In the southern state of Rio Grande do Sul hospital, patients must line up to wait for the beds as occupancy rate is intensive. Care units soar past 103%. The neighboring state, Catarina, has already surpassed 99% occupancy and is on the verge of collapsing as cases surge throughout the state. You can see what India is facing right now already happened in Brazil. The healthcare system is collapsing, and much more we will talk when we will study India. Reasons for the spread of second wave. Let's move to the reasons behind this. Some major reasons can be health workers blame gathering. Second, while a new variant of coronavirus spreads throughout the country, many Brazilians continue to defy mask and mandates mobility restriction following example of President Jair Bolsonaro, who recently said people need to stop being sasses and whining about virus. Third, lack of security measures taken by people and ignoring the threat of virus. How to overcome it? First, vaccination. Hope could be on its way in the form of vaccine, but Brazil's vaccination rollout was slow in comparison to other countries, including other in regions like China and Mexico. In January, health regulator Anvisa authorized the emergency use of vaccine by Sinovac and Oxford AstraZeneca. Since then, roughly 4% of Brazil's 211 million citizens have received at least one vaccine dose, according to the data from Brazilian Health Ministry. And 2.3 million have had two doses, according to Health Ministry Brazil. Is in negotiation to buy Pfizer, Moderna, Johnson, Sputnik, and Covaxin vaccine. Thou only the Pfizer biotech vaccine among those has been the granted authorization from Anvisa. Second, paying more attention to the health and safety methods of social distancing, better contact tracing, and now providing availability of ICU beds and other facilities. Economic crisis. Moving to the economic losses, there is a much economic loss. The social and economic crisis triggered by COVID-19 pandemic pushed 83.5% of the labor market in Brazil into the state of vulnerability, and even with the emergency policies, we estimate that at least 26 million workers, that is over a quarter of economically active population, will not have access to any compensation, whether unemployment insurance and EBI, emergency basic income, or right to significant withdrawal from their workers' fund, that is length of service guarantee fund. All that is left for them is bankruptcy and layoff of the emergency assistance program for formally registered workers. Recovery. The recovery rate is slow and exports are slowed down. People are on now being employed hoping Brazil will be rise up again. What India could have learned from them? By seeing the condition getting worse than in Brazil, we could have made prior arrangement of ICU beds, oxygen, and other health related things. This is one of the estimate steps that should be taken by government of any country. Second, we could have to make hospitals rather than investing money in some useless construction. Third, we could have postponed the elections and thus could waited for the end of second wave for conducting elections. Elections happen and experts believe that is the main reason for the second wave of corona in India. This is all for this video, and if you have questions, please feel free to ask in comment section. The next video will go more interesting and knowledge. We will talk about India, how corona enters and nightmare second wave, what is the current situation, and more we will cover some major points. If you want a video on some detailed topic or some other topic, please comment down below. We will make it for you. Share this video with your friends and family for the awareness and knowledge. And subscribe the channel so that you will get notification of coming video. We will donate all the revenue coming from these videos. Be with us, we will come with some more nations and their tackling strategies. Till that, be safe, take care, wear mask. We will meet you in next video.